Hello students. Today we are going to discuss about the venous drainage of upper limb. This is again a very important question for your university exam. You have small segments, and at the end of this class I will tell you how these segments will ask in your exam. So let's discuss this topic. First question comes is about the general orientation of the veins in upper limb. Now when you will have the upper limb veins, the superficial veins always run away from the pressure point. What does it mean that when you will see the upper limb, this is your dorsal surface, this is your ventral aspect. The dorsal aspect is always having the pressure points like this tip of your elbow where you will sit and you will provide you put the pressure here. In the same way, on the margins you will keep the hand in such a way that these are the pressure borders of your upper limb. So these points, if continuously providing pressure on the veins, it is going to hamper the venous drainage. In the same way, when you are holding something in your palm, and if the veins are prominent in the palm, it is going to obstruct the venous drainage, and that is again going to create the swelling in your palm. So that is the important thing, that the veins always run away from the pressure points like the palmar surface, like the ulnar border of the forearm, back of elbow, back of your trunk. So veins are trying to reach in the superficial layer where you don't have the pressure point. The superficial veins, that's why make a spiral course, and they runs from dorsal to ventral surface. So that is the important thing. The venous drainage comes from dorsal to ventral surface. Why? Because the ventral surface is not having that much of pressure point. So veins are draining from this posterior side to the ventral side in your limb. Now, when you will see the veins of the upper limb, you will find that these veins are taking blood towards the heart, but the superficial vein which become deeper earlier is more efficient in this venous drainage. So earlier the vein become deep is more efficient, but the question comes is how? Why the deeper veins are having more efficient venous return? The reason is that the venous return is assisted by the muscular contraction into the deep veins. So what will happen, that you know that veins are not having the muscular wall as compared to the arteries. So once this vein is become deep, now in this image you can see that this is the vein which is visible here, but this vein entered at this point by piercing the deep fascia. So what will happen if you will cut this section, and you will see that inside the deep fascia the vein is present, and this is the bone. So the vein is surrounded all over by the muscles. So muscles are here and the muscles are surrounding this vein. So the muscular contraction is helpful to push this blood towards the heart. The second important thing is about the facial compartment. Now, when the compartments are there, you know that the deep fascia will show the intermuscular septa, and these compartments are helpful for this effectiveness of the pressure on the deep vein. So these are the two basic reasons that why the deeper veins are having more efficient venous drainage. So in the upper limb, on the medial side, you will have basilic vein. On the lateral side, we will have cephalic vein. So basilic vein become deeper earlier. So this question has been asked so many times in your exam, that why the basilic vein is more efficient in venous return as compared to the cephalic vein. The answer is that the cephalic vein is remain superficial for a longer path, while the basilic vein become deeper in the mid arm. That's why it is more efficient in venous return. Which are the other factors helpful in the venous return? Answer is negative thoracic pressure. Now when you will have the inspiration, what will happen? Air enters into the lungs because of the negative pressure. So the cavity itself is having negative pressure, and at that time not only the air is entering into the lung, but the blood is also entering into the heart. So the negative thoracic pressure is helpful in the venous return. The second thing is the accompanying artery. Now this is the important thing to understand, that whenever you are having the veins in the body, there are two sets of the vein, superficial vein and deep vein. You have to keep this thing in mind, that superficial veins are not accompanying the artery. Superficial veins are accompanied with nerves and lymphatics. nerves and lymphatics. These are accompanying with the superficial vein, but the deep veins are accompanying with the arteries, and that is the important thing, that these accompanying arteries are helpful to transfer their pulsation into the veins, which are helpful in the venous return. Then you will have the presence of valve. You know that the valves are helpful for the unidirectional flow of blood. Which are the other veins of upper limb? So the veins which are draining the upper limb are grouped into the superficial veins and the deep vein. Now when you will see the superficial veins, these veins are named as dorsal venous arch, cephalic vein, basilic vein, and median cubital vein. So let's discuss one by one. First is your superficial venous arch. Now when you will see the superficial venous arch, it is present on the dorsum of hand, and that's why it is known as dorsal venous arch. Why it is known as dorsal venous arch? Because it is present on the dorsum of your hand. Now this is arch because it is a arch shape structure. Now here you can see in the hand, this is a arch shape structure which is present on the dorsal surface of your hand. That's why it is known as dorsal venous arch. Now this is the network which lies in the superficial layer, and when you will see the formation of this arch in this image, what you are able to understand, that this arch is having a U-shaped structure, and this U is formed by the different tributaries. Now how many tributaries? So but here you can see that this is the one tributary, this is the another tributary, and this is the another tributary. Now these tributaries are known as metacarpal veins. So how many metacarpal veins? There are 3 metacarpal veins. This is first, this is second, and this is third. So there are 3 metacarpal veins. Now apart from metacarpal veins, this arch is receiving a digital vein from the medial border of the finger or little finger. Then it is receiving the digital vein from both the side of thumb, and it is receiving the vein from the lateral border of index finger. In such a way, you will have the 4 digital veins. So there are 4 digital veins, there are 3 metacarpal veins. All these veins will join, and in this form you will have a dorsal venous arch at the dorsum of your hand. So this dorsal venous arch is having tributaries. How many tributaries? I told you 3 dorsal metacarpal veins, and there are 4 dorsal digital veins. Clear? Now when you will see the dorsal venous arch, it also receives the blood from palmar surface. I already told you in the initial part of this class that palmar surface is not having the venous arch. The blood of this surface will go dorsally. Why? Because it is a pressure area. So there are perforating veins. Now between the metacarpals, there are spaces are known as interosseous space, and through those spaces venous arch. So the blood of your palmar surface goes into the dorsal aspect of your palm. So this is the important thing to understand. Now what will happen, that the dorsal venous arch, both end give rise to the 2 veins of upper limb. The medial end is going to give rise your basilic vein, and lateral end will give rise to your cephalic vein. So we'll discuss these veins one by one. So first we'll talk about the cephalic vein. Now when you will see the cephalic vein, this cephalic vein is present on the lateral border of your upper limb. Now this cephalic vein is known as cephalic because it is a longer vein which is going to the cephalic end of your upper limb. That's why it is named as cephalic. So it approaches the cephalic end of the upper limb. That's why the name comes cephalic. Now it corresponds to the great saphenous vein of the lower limb, and it is known as preaxial vein. Now these are the 2 questions which you have to understand, that when you will see the lower limb, in the lower limb on medial side you will find a long vein is known as great saphenous vein, but in the upper limb on the lateral side you will find a long vein is known as cephalic vein. Now embryologically, this upper limb is having the outer border is known as pre-axial border and inner border is known as post-axial border. So this cephalic vein is running on the pre-axial border, that's why it is known as pre-axial vein. Now we have to understand its beginning and the course. So from where it begins, I told you it begins from the lateral end of dorsal venous arch. So it is a continuation of the lateral end of dorsal venous arch. Now in this diagram, what you are able to understand that this is your thumb. So this will become the lateral end of dorsal venous arch. Now from this lateral end, you are able to see there is a vein is going upward, is known as cephalic vein. So what is the origin of cephalic vein? Lateral end of dorsal venous arch. Now what is the course of the vein in the forearm? Now there is a one important landmark. As soon as this vein starts from the dorsal venous arch, if you will do the hyperextension of your thumb, you are able to see a triangular depression at the base of thumb. Now that depression is known as anatomical snuff box. What is that? Anatomical snuff box. So this vein runs into the roof of anatomical snuff box. Now after what will happen, that this vein start to make a spiral course along the lower end of the forearm and then comes on the forearm. So it will winds around the lateral border of the lower part of the forearm and then it comes anteriorly along the lateral side of your forearm. Now this is going to run upward. Now where it runs, it will reach into the cubital fossa. Now where is the cubital fossa? Now if you all see your elbow, in front of the elbow, you are able to see a small shallow depression. Now this small shallow depressed area is known as cubital fossa. So this vein, once formed at the medial lateral end of the dorsal venous arch, runs in the roof of anatomical snuff box, take a spiral course, comes on the anterior side of the forearm, run along the lateral border, and then finally it approaches the cubital fossa, which is an area in front of your elbow joint. Now what will happen? This is your arm. What is that? Arm. So from this cubital fossa, it is going to enter into the arm. So what is the course in the arm? It runs upward in the arm along the lateral border of a muscle is known as biceps brachii. Now here you can see this is the biceps brachii. You all can feel your biceps here. So this vein is now going to run along the lateral border of the biceps into the superficial fascia. Now once it will reach here at this point, that means when you will see here at the lower border of the pectoralis major muscle, now there is a muscle is known as pectoralis muscle. So at the border of pectoralis muscle, it pierces the deep fascia and it will enter inside. Now on the deltoid, it is not visible. So what will happen? It pierces the deep fascia at the lower border of pectoralis major muscle. Now if you will cut this deep fascia, you will find that this portion of the vein lies between the two muscle. Now what are the name of these two muscle? Now here on the lateral side, this muscle is known as deltoid, and on the medial side, this muscle is known as pectoralis major. So this gap between these two muscles is known as deltopectoral groove. So this is the deltopectoral groove. So once the vein pierces the deep fascia, it becomes deep, runs into the deltopectoral groove. Now what will happen? It then again reaches just below the clavicle and re-pierces one more deep fascia, that is known as clavipectoral fascia. So it pierces the deep fascia at two times, one below the low border of pectoralis major, second just below the clavicle where it pierces the clavipectoral fascia, and finally where it terminates, it ends into the axillary vein. So you are able to understand that cephalic vein is having a very long course starting from the lateral end of dorsal venous arch, then it is running, and at this point it becomes deep, and then it runs into the deltopectoral groove, and after that it enters into the axillary vein by piercing the clavipectoral fascia. So here in this diagram, what you are able to see, that this is your vein. Now this vein is superficial. Now here it will become deep, and then it is piercing this clavipectoral fascia below this clavicle bone. Now deep to that, this is the axillary vein. and this cephalic ultimately drains into the axillary vein. Now, the venous blood of the cephalic vein greatly drains into the basilic vein also while it is going above. Now, there is a connection is present between the cephalic and basilic vein, and that is known as communicating vein. Now, the main and important communicating vein here is median cubital vein. Now, this is an important communication, and it transmits most of the blood of cephalic vein towards the basilic vein. Why? Because initially I told you that basilic vein is more efficient into the venous return because it become deeper earlier. So what will happen physiologically, that major blood which is drained by the cephalic vein bypass towards the basilic vein by connection in between them, so that the more of the blood will reach to the heart as early as possible. So that connection from cephalic to basilic is known as median cubital vein. Apart from that, there are some perforating veins are present, and they are transfer the blood from superficial veins to the deep veins of upper limb, and these perforators are having the valve to determine the unidirectional flow of blood. So in this diagram also you can see that this is your cephalic vein, this is your basilic vein, and in between them you can see this is the connection, and this connection is known as median cubital vein. And apart from that, there are perforators present in the whole course of the cephalic vein, which are actually going deep to connect it with the deeper veins which are present inside the upper limb. Now, when you will see the cephalic vein accompanied by which nerve, because initially I told you that always you have to keep this thing in mind, superficial veins accompanying with the nerves, while deep veins accompanying with the arteries. So which nerve accompanying the cephalic vein? Now this is the question which has been asked so many times. So dear students, when you will see the upper part of the forearm here, you will have a lateral cutaneous nerve of forearm. So lateral cutaneous nerve of forearm runs along with the upper part of cephalic vein, while in the lower part of the cephalic vein, it is accompanying with the superficial branch of radial nerve. Superficial branch of radial nerve. So here in this part, here you will find lateral cutaneous nerve of forearm, and here on the posterior dorsal side near the anatomical snuff box, it is related with the superficial branch of radial nerve, which is visible in this image. Here you can see that this is the superficial branch of radial nerve, which is more near to the formation of your cephalic vein, and here this is the cephalic vein in the lower part of the arm or upper part of forearm, where it is related with the lateral cutaneous nerve of forearm. Now we'll move to the next vein, is the basilic vein. Now basilic vein, I told you it starts from the medial end of the dorsal venous arch. So it lies on the medial side of the upper limb, and it represents the post-axial vein, which I already told you, the pre-axial border and post-axial border, that means the medial border. It corresponds to the short saphenous vein of the lower limb. So lower limb will also have the two similar veins, but the names are short and long saphenous vein. So long saphenous correspond to the cephalic vein, and short saphenous correspond to the basilic vein. Now this vein become enter deep fascia earlier, which I already told you, and because it become earlier deeper, that's why it is known as basilic, because basilic means deep. So this vein become deeper earlier, that's why the name comes basilic. Now from where it begins, we have already seen it begins from the medial end of dorsal venous arch. Now what is the course? Now course is little bit different from the cephalic vein, that it runs upward along with the back of medial border of forearm, and it winds around the medial border near the elbow. Now see, here you have to understand this thing, that if you will see the forearm, now on the forearm, lateral border is having the cephalic vein more, but here on the medial border you will not find basilic vein, because basilic vein exactly not running here, it is running on the posteromedial aspect. It is not running here, it is running on the posteromedial aspect, while cephalic vein comes on the anterior aspect of the lateral side of forearm, while the basilic vein, once it will form, it remain here on the posteromedial aspect of forearm. Clear? Now this is a disadvantage with the basilic vein, because when we will see the formation of AV fistula, the basilic vein is difficult because it remains here, not here. So arteries are present on the anterior aspect, vein is on the posteromedial side. So if you want to connect both, you have to do more dissection and you have to do the transposition of the vein. That's why the basilic vein generally not preferred for the arteriovenous fistula or AV fistula formation in case of hemodialysis. So this is the important thing to understand, that when you are seeing the basilic vein, this basilic vein is not seen here in the forearm. You are not able to see the vein is present here in this region. So this is the thing which you have to understand, that sometimes what will happen, that this question may be asked, that why basilic vein is not preferable vein for AV fistula. Then it reaches on the anterior aspect of cubital fossa. So once it will come out here, it then make it turn on this upper part of forearm, and then it comes on the elbow anteriorly. So this cephalic vein comes very early anteriorly, while the basilic vein comes anteriorly in the upper part of forearm, and then these both veins are present anteriorly on the cubital fossa, where they are connected by the median cubital vein. Clear? Now the another important thing is that what is the course of this vein in the arm? Now it pierces the deep fascia, which we have already discussed, that the basilic vein become deeper earlier by piercing the deep fascia at the mid arm. So at the mid arm, this basilic vein ascend and goes deep, and it pierces the your fascia. It runs upward on the medial aspect of the brachial artery. So you have seen that this is the medial side of the arm. So at the middle, this basilic vein is going to pierce your deep fascia, and then what will happen at the lower border of the teres major, it continue upward as a axillary vein itself. So what we have seen, that cephalic vein is going to drain into the axillary vein, while basilic vein itself continue as a axillary vein. So here in this, what you are able to see, this is the point where you are able to understand that this is your vein and this vein is here. Now this vein is nothing but it is the axillary vein, and this axillary vein is a continuation of the basilic vein, where it joins the some more tributaries. But this cephalic vein is going to open into this axillary vein. So these are the differences which you have to keep in mind, that what is the termination of basilic and cephalic. So cephalic terminate into the axillary vein, while the basilic continue itself as an axillary vein after taking 2 or 3 more tributaries. Now, so what is the termination? The basilic vein joins with the vein accompanying the brachial arteries, which are known as venicomitants. So these venicomitants, which are the tributaries of this basilic, all 3-4 veins join and they will make a larger vein, is known as axillary vein. Now, in the lower part of the arm, you will find that it is also accompanied by the nerves. So that is the thing which I am saying again and again, that superficial veins always accompanying the nerves. So which nerve accompanying the basilic vein? Answer is medial cutaneous nerve of forearm. So which nerve was with the cephalic vein? Lateral cutaneous nerve of the forearm, while it is having the medial cutaneous nerve of the forearm. The medial cutaneous nerve of forearm sometimes mistaken as a ulnar nerve. So this is to be keep in mind when you are dissecting. You will find that ulnar nerve is a deeper nerve, while it is a cutaneous nerve, so it is a superficial nerve. Second thing is, this superficial nerve is present along with the superficial vein, which is known as basilic vein. So when you are dissecting, you have to try to find out this accompanying vein with the basilic vein, which is medial cutaneous nerve of the forearm. Now we'll move to the next nerve, is the medial cubital vein, which is a separate short note for your exam. So median cubital vein is a small communicating channel. I just told you why it is a communicating channel, because it is transferring the blood from cephalic to basilic. So cephalic to basilic, it is transferring the blood and it crosses obliquely in front of the elbow joint. Here it lies in the cubital fossa. So here in this diagram you can see this is the oblique vein. So what is the direction? From cephalic to basilic. So it has to be cephalic, it has to be basilic, and this should be the direction of this vein. Clear? Now when we will move to the next part of the median cubital vein, the question comes is from where it begins. So it begins from cephalic or it begins from the basilic? Answer is it begins from the cephalic. So it begins from the cephalic 2.5 centimeter below the band of elbow. So it is almost, this is the band of your elbow. So 2.5 centimeter below from the cephalic it starts. Then it crosses obliquely. So it is not horizontal vein, it is a oblique vein. So it goes upward and medially, and it lies in the roof of cubital fossa. And where it terminates? It terminates into the basilic vein, and it starts from cephalic vein. So it is 2.5 centimeter below, and it ends 2.5 centimeter above. So this is your crease of your elbow. So 2.5 centimeter below it is starts, and 2.5 centimeter above it ends. So it is a oblique vein which is present in the roof of cubital fossa. Why we are using word roof? Because it is a superficial veins and superficial layer present in the roof, that means just below the skin. Now in the cubital fossa, the median cubital vein is separated from the brachial artery by the bicipital aponeurosis. Now this is the something is important concept which you have to understand in this diagram. Now what this diagram is showing, that when you are going to dissect the cubital fossa, you are going to remove the skin, superficial fascia and deep fascia. Now deep fascia of the cubital fossa is having a one modification of the bicipital aponeurosis, which is a tendon of biceps brachii. So here you can see that this is the bicipital aponeurosis. Now when we are talking about the median cubital vein, I told you the cubital vein present in the roof. That means when you remove the skin, when you will remove the superficial fascia, in the fascia the vein is present. Now deep to the superficial fascia you will find this aponeurosis, and deep to aponeurosis you will find this brachial artery and median nerve. So this brachial artery and median nerves are separated from the superficial layer by the this deep facial modification, which is known as bicipital aponeurosis. Now there is a one important thing is that median cubital vein is connected with the deeper vein by the perforators. There are perforators. Now these perforators are very important and having the practical role. Now in this image what you can see is that this is your median cubital vein. Now this medial cubital vein present into the superficial fascia. Now these are the veins which are deep veins, and these deep veins are connected with the superficial veins with this perforator. Now what is the advantage of having perforator here? That this perforator fix the vein in its own position, because from below it is having a connection. Now because of that this vein will not move here and there, it will not displace. So this vein is preferred for the intravenous injection because of two reasons. It lies on the bicipital aponeurosis, which will provide the hard surface to the vein, and second, it remains fixed on its own position because below it is fixed by the perforators. So these are the important thing, that the perforating vein pierces the aponeurosis and it fixes this vein and make it suitable for the injection. Why? So that it will not slip when you are putting the needle into the vein. Apart from that, the perforators are having the valve which allow the unidirectional flow of blood. So what is the clinical anatomy? Why we are reading the superficial veins? So first is the venipuncture. So superficial veins of upper limb are most commonly used for the IV sampling or to give the IV injections. So superficial veins are more commonly used for the venipuncture. It is a process to obtain the sample or for the purpose of giving the drugs. Second use of these veins are constructions of fistula. Now I told you that there is a formation of fistula between the artery and vein, which is known as AV fistula. These fistulas are formed for the hemodialysis. What is hemodialysis? Hemodialysis is a treatment in the case of bilateral renal failure patients where the kidneys are not able to excrete the material from the body. So what will happen, that we have to create the fistula in the artery and vein communication. Now what it will do is that once you will connect the artery with the vein, the arterial blood will start to go into the vein, and slowly what will happen, this high pressure blood from artery increase the diameter of the vein, and it also causes thickening of the wall of the veins. This is known as arterialization of the venous wall. Now these veins are then further used for the repeated puncture in the dialysis. But the question should be come in your mind that why we are not using arteries directly for the dialysis. The answer is here that arteries are never used for multiple punctures for the dialysis or for any reason. Why? Because the arteries can lead to the repeated puncture is not possible because arteries are deep. The important thing is that if you will do the multiple punctures in the artery, there may be a heavy bleeding. The artery may show aneurysm because of the damage in the wall of the arteries. The spasm may be there. There may be a formation of thrombus, clotting may be there, and there is a loss of distal blood supply of the limb, which will lead to the ischemia of the limb. So because of these reasons, the artery is never used directly for the multiple punctures. Before that, doing this, what we will do is, we will find out the nearby vein, connect the artery with the vein, and allow the vein to convert into the arterialization. That means the wall of vein become thick, and then that vein will use for the multiple puncture in the hemodialysis. Plus the venous pressure is also become higher in the vein, which is required for the dialyzer machine to work sufficiently. Now this is the another job of the superficial vein is cardiac catheterization. What is cardiac catheterization? A small catheter pass through the basilic vein, and that catheter will reach in your heart to see the condition of your valve and other things. But why not the cephalic vein? The cephalic vein is not used for the catheterization because what will happen, you know that this is the cephalic vein present on the lateral border. Now this vein is having an acute opening into the axillary vein here. So when you will pass the catheter will get stuck below the clavicle or it may kink. So that's why basilic vein is always preferred for the catheterization. So which vein preferred for the hemodialysis? Cephalic vein. Why cephalic vein is preferred? Because it is more superficial and it is near to the artery. So it is available for the cannulation, AV fistula formation. But the basilic vein is not used because I told you it is more on the posterior side. And second thing, the course is very small here, it become deep earlier. So the basilic vein, the length of basilic vein is not properly available also. And if still you want to do the formation of fistula with the basilic vein, then you have to do the more exploration, that is known as transposition of the vein to take out near the artery. The another important thing is, so these are the some important questions which may be asked from this chapter. Why the basilic vein is more efficient venous return as compared to cephalic? Why median cubital vein is suitable for the IV injection? Why cephalic vein preferred for the hemodialysis? And why basilic vein is preferred for the cardiac catheterization? So these all are the important concepts which you always keep in mind when you are reading this chapter of venous drainage from your upper limb. So this is all for today's session. Thank you and bye-bye.